Hi everyone, this is Jacqui Cooper with JCooperTravels, and I wanted to thank everyone for listening, and I wanted to also share with everyone that today I have Dr. Brown on. This is an ongoing series that we have. Dr. Brown has a wonderful practice that she's able to do over Zoom, and we're talking about a lot of different topics that involve health and wellness, both when you travel as well as when you stay home. And definitely subscribe to the podcast, subscribe to the YouTube channel, so that way you can keep up to date on all the different topics that she's going to be bringing to us over the course of the year and beyond. And Dr. Brown, thank you so much for being here. For those that might not be aware of your background and your practice, can you just do a short introduction, and then we'll get into our topic of the day.
Okay. Yes. Thank you, Jacqui. My name is Dr. Tiffany Brown. I'm a naturopathic doctor. And I got into this field because I had women health issues. And I was like dealing with it for years and seeing different doctors. They was doing what they knew, what was best, but I wasn't seeing any results. So I just started looking into the natural world online, seeing what they were doing. Saw a lot of things, was lost, didn't really know how to go about it. So I just picked one thing out and I saw results. And I just said, okay, let me go from here. I started looking for somebody holistic that was close to me, couldn't find nobody, naturopathic doctor or anything. And I was like, okay, I can do this. So 4 years later, after all the schooling, here I am ready to help the next person.
So today we are going to be talking about hypertension. I know nothing about hypertension, so I'm going to ask you some questions related to that. But what's a quick definition of hypertension?
This a quick definition of hypertension is, I want to say hypertension is not a disease. It's what it is it's a sign of something that's going on in the blood vessels. And we as naturopathic doctors, you have to look and see, okay, what's causing this disturbance in the blood vessels. The medical doctors, they look at it as, okay, you got hypertension. We need to just stop this process from happening. But in other words, it could be, your diet, or maybe a lack of nutrition or dehydration or sleep that you're missing. It could be anything, a secondary cause of some other condition that's coming along. So it's just something that's in the blood pressure, and it's saying, okay, telling your body's telling you, okay, something's going on, you got to fix it. So that's what us naturopathics do. We just look, do an assessment of everything that's going on in your life, and then start telling you what you need to do to bring the body back into balance.
It is all about balance. You're definitely
Mhm.
right about that. So, what might be some things that would cause hypertension? What
Okay.
put your body out of balance?
Yeah, some things like everybody likes to say genetics, that's the reason why, but genetics plays a part in it. Also, if you're not eating a proper diet, that's another problem. And if you're eating a lot of salty processed foods, that's another issue. And dehydration is an issue also, because if you dehydrated, your blood gets thicker. So your body, your heart has to pump harder to get the blood through your blood vessels. So it could be just dehydration, and it could be sleep, because if you have plenty of nights of lack of sleep and you're not sleeping properly, or maybe it's sleep apnea where you're not getting enough air in, and you're waking up frequently, that could be a problem, because that will cause your blood pressure to elevate. Smoking is another issue. A lot of people, they always want to cover that one up. And just it could be just maybe some other secondary causes like diabetes, or um, kidney disease problems and things like that. So it could be just like a secondary problem to something else in addition to, and most definitely stress. Didn't want to leave that one out. Stress is a big issue also.
Yeah, and stress, I mean, is plays a lot with our mindset.
Yeah.
So, how we view challenges or our personal situation. So
Mhm.
definitely stress it can definitely happen when you're not even realizing that you're stressed.
Exactly. So true.
So, what effects does hypertension have on the body? So, if you And how do you even test to know that you have it?
Yeah, yeah. Hypertension it's just a simple blood pressure test. You can go like Walgreens and Walmart has those machines set up to where you, if you just there, you can just stop there and just test your blood pressure real quick and see what's going on. Um, I know when some people get to doctor's offices, their blood pressures automatically rise because they're in the doctor's office. So they like to call it white coat syndrome. If you know if that's the issue, then I would advise you to buy a blood pressure machine and take your blood pressure every hour to get a reading to see if it is white coat syndrome. Because if it is white coat syndrome, when you come home, your blood pressure is going to be down to normal, which is like the less than 120/80. And then you want to take your machine to your doctor because the machine will memorize all the recordings, and you can show your doctor. It's really just I'm in this office. The reason why my blood pressure is up. So, but the effects of hypertension can cause like renal damage. It can cause coronary artery disease or heart failure or strokes. So you most definitely want to catch it at the earlier stage. I always use the analogy of like when you're watching a cartoon and the snow coming down the hill and you're watching the snowball get bigger and bigger and it hits you and then you roll on down the hill with the snow. And you don't want that to happen, because it's like other conditions are piling up by this time.
Yeah, no, you definitely don't want to do that. So now when someone has hypertension, how do they feel?
Yeah. They'll get some of them, if it's really high, they'll get headaches. They'll might feel a dizzy. Sometimes they can be sitting and they'll stand up. They'll feel a little dizzy, a little lightheadedness. Some people don't even have any idea it's elevated because their body's gotten so used to it. So they might not even have no symptoms. You know, it prolonged, you can start seeing eye problems. You can start having vision problems if it's chronic. You can also, because you had causing renal damage, you might see something there, especially in your blood work.
So you had mentioned that the American Heart Association has a set of new guidelines to determine the stages of hypertension.
Yeah.
What are they?
Okay, so in 2017, the American Heart Association has came out with some new guidelines. So if you've seen your doctor recently, and if you have any high blood pressure issues, now it was 120/80 was good. That's what you wanted. If it was 120/80, that was good. But once you start, like now they're saying 120 to 129 of the top number is which is your diastolic, is considered elevated now, which it wasn't in the past. And so, and now then when you're in that stage, they're starting to work towards wanting you to bring it down. So they'll start talking to you about diet, getting some exercises and stuff, and reduce your sodium. So that's what your doctor will start saying to you at that 120 120 to 129 as the top number, which is your diastolic. When you start getting to 130 to 139 over which is the top number over that bottom number 80, now they want to start with some blood pressure medicine. So, and that's where, because their idea is they want to bring it down. And so what we do is we want to say, okay, what's going on? Why is your blood pressure elevated? And I'm gonna ask you, why your blood pressure elevated? What's going on? What kind of stress are you under? Are you getting any sleep? Are you drinking water? We're gonna go and boom, boom. I'm gonna ask a lot of questions, to dig it out. And with me, as a naturopathic doctor, I might not treat the high blood pressure. I might treat something that's in association or causing the high blood pressure. So I might not even treat the high blood pressure at all. If it's genetics, okay, then I might treat the high blood pressure. If it's genetic, if your diet is good, you're exercising, you're not smoking, and your stress is down, you're getting sleep. Okay, maybe it is genetics. Okay, maybe we need to just treat the blood pressure then. So it's just uh, what comes out in the visit.
So if you are treating the blood pressure and everything else seems to be okay, how do you treat blood pressure? Do you look at it from a medical perspective? Do you look at it from an herb perspective? How do you do that?
So if everything's okay, and you say if it was genetics, um, I would just mainly I try to run maybe a few tests to see just to confirm there's nothing in the blood work in the with the liver. Is your kidney function good, and is the electrolytes okay? If that's fine, then I'm just gonna maybe start with maybe like something like garlic to kind of help bring it down, or some other type of herb. We got some really strong herbs, and if I have to, we'll inch up. And then if I feel like it's not coming down and it's really high, then I will have to send, maybe to the emergency room or to your medical doctor. But at least we want to try the botanicals first to see what we can get to, get it to come down.
So one of our last podcasts, you had talked about garlic as well. Garlic seems to be, has a lot of strong properties to it, I'm hearing. So I might have to include garlic in my diet.
Yeah. 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 It won't hurt.
So I definitely have an understanding now more about what hypertension is all about. You had mentioned though that sometimes the symptoms don't show up.
Mhm.
So I guess the only way to see if you have hypertension is by testing your blood, your blood work. And is that something that your doctor should do every time you visit, or should how do you monitor this just to make sure you're again staying in balance?
Yeah. So when you do go to your doctor, they will test it, but you can buy an at-home machine. So if you like, if I had, if I had a patient that was hypertensive, I would require them to have an at-home machine where I can see the recordings that they've done, so I can make sure we're seeing the blood pressure decrease. And even with me, I prefer for my patients to have a medical doctor anyway. So even if the doctor want to work along with me or don't, I still require them to have a medical doctor and still be doing their medical visits. So just to make sure we're on the same line, same page, and everything looks good.
That makes sense. That makes sense. Well, I really appreciate your being here and educating us about this really important topic. Well, you know what? Another question just popped into my mind. What happens with travel?
Yeah.
How does hypertension affect, how are you affected on an airplane, with elevation? If you're at higher, levels, like if you're in the mountains,
Mhm.
does that matter? I mean, or is it the same no matter where you are?
Okay, there is, if you, I would say you want to see a medical doctor, because sometimes if the blood pressure is really high,
Mhm.
they want to, especially traveling for long periods of time, because people with hypertension tend to, and even like normal people, can throw a blood clot for sitting for long periods of time. So I would just say, because I'm not able to, touch and to assess a patient, to maybe follow with a medical doctor on that, just to see, just to confirm, because like traveling in high altitudes in an airplane can be kind of risky for those patients. And but if you can travel, go and enjoy it. Most definitely travel. That'll reduce your stress.
I know, right?
Reduce your stress, yeah. So travel, enjoy.
That's part of what the wellness and I mean, when we travel, it's to kind of get out of our own head and just to kind
Yes,
of relax. So,
yes,
and we definitely need that.
yes.
Um, Well, thank you so much for being here. I look forward to our next episode. Everyone go ahead and subscribe to the podcast as well as to the YouTube. Like, as I mentioned earlier, Dr. Brown's contact information will be in the information below. So that way you'll be able to reach out to her. She can advise you on a number of things, health related. So that way you can stay healthy, maintain your balance, and always stay happy. So thank you so much for being here today.
Thank you. Mhm.